James Harden, point guard of the Houston Rockets, has made it famous. We've all seen it. Some know what it is, and others don't even bother with it. What am I talking about? Kinesio tape. The magical, colorful tape many Olympians have been covered with for the past few years. Kinesio tape is not just for athletes. It has been used for babies in the NICU all the way to the elderly in the nursing homes. Many people benefit from kinesio tape to help return from injury or to correct a positioning flaw that is causing pain. Today, we will be discussing the history of kinesio tape, reasons why it can be used, and common application techniques. Specifically, we will talk about the inventor of kinesio tape, Dr. Case, 2 reasons why it can be used, and 2 common applications. We will begin by familiarizing ourselves with the inventor of kinesio tape, Dr. Kenzo Case, and how he came up with the invention. As with almost all inventions, kinesio tape was born out of necessity. Dr. Kenzo Case is a chiropractor based in Japan who was looking for a way to support his patients' healing from the end of one session to the next. Dr. Case, being intimately involved with the human body and the responses to stimuli, formulated a thin tape that can be applied to the skin to facilitate or inhibit muscle tone. The kinesiotaping.com website states that Dr. Case invented kinesio tape in the 1970s and has since perfected its design and different application techniques. Dr. Kenzo Case did not just come up with an idea for the tape and then sit back to watch and see what others would do with it. His priority has always been making his patients feel better. In addition to the input of thousands of trained professionals and practitioners and instructors worldwide, he continues to be active in the development of applications, products, and adaptations, all designed with the goal of better patient care. Dr. Case has continued to grow his company throughout the years through increased use with sports teams and even equine taping with horses in the Kentucky Derby. According to Horse and Hound magazine, kinesio tape can be effective in treating horses with lymphatic drainage issues and chronic conditions including kissing spine and elongated tendons. Now that we have a firm understanding of the history of kinesio tape, let us look at 2 different uses of the tape. Understanding what kinesio tape is said to correct will help us understand why it has become so popular across the healthcare field. We have all experienced pain at some time in our body. Pain control with the use of kinesio tape is an attractive aspect for healthcare professionals to help their patients feel better. Joint disorders are the number 2 reason people go to the doctor, according to the Huffington Post blog about the recent Mayo Clinic study about reasons for doctor visits. Many joint disorders, which often cause pain, can be treated through the use of kinesio tape to relieve pressure and support joint movement. Edema control is another common use for kinesio tape in many clinics across the nation. Patients are eager to return to their daily lives, and edema inhibits their ability to do so effectively. In an interview with Dr. Kenzo on YouTube.com with Massage Therapy Canada magazine, he states that opening the micro space just under the skin allows for the flow of fluid through and away from the congested area, which reduces inflammation and edema, and in turn reduces pain. Lastly, we'll look at 2 different application techniques of kinesio tape and the specifics that go along with them. The application of kinesio tape is very specific depending on the goal of the practitioner. Application for muscle facilitation and application for edema control are 2 different methods. One of the most notable applications for kinesio tape is for muscle activation and support of a joint. Although there are other sports tapes that address joint movement, they also restrict it. This was one of the problems Dr. Case was sought to overcome with his creation of kinesio tape. This allows the joint to move freely but correctly. It is to be applied with 50 to 75% tension in a Y or an I strip. In the book, Clinical Therapeutic Applications of the Kinesio Taping Method, Dr. Case talks about mechanical correction or recoiling application, saying that the degree of stimulation is determined by the stretch of the tape and the inward pressure applied by the practitioner. Edema control is another situation that can be alleviated with the application of kinesio tape to the affected tissue. This requires specific knowledge of taping techniques to apply it correctly. It is applied with a 0 to 15% tension in a fan-like manner with the base close to the lymph nodes to absorb the exudate. This is called lymphatic correction or channeling. According to an article in the Journal of Hand Therapy, Effectiveness of Edema Management Techniques for Subacute Hand Edema, a systematic review, kinesiology tape is designed to mimic the skin to allow greater interstitial space and increase lymphatic drainage. As we can see, there is more than one way kinesio tape can be utilized, not only in sports, but for the everyday person. I hope that this speech has given you a brief yet enlightening picture of how kinesio tape came to be, what it can be used for, and how it is commonly applied to correct pain and edema and promote healing in damaged tissue. Now, when you see athletes wearing the brightly colored tape, you will know what it is and some of the many ways that it can be used to assist people in sport and daily life. Thank you.